I'm Roberto, I'm CEO of Derma Group, and today we have
Lee Walker.
And we are literally just going to have kind of a brief chat, I think, just about industry, safety, where things are going to, and yeah, just a general chat really, isn't it? And so what's kind of your opinion on, I suppose, the industry, and I suppose because we're a device manufacturer, kind of what's your views on devices, safety?
I mean, the regulations have changed. There used to be regulations based around energy-based devices, and those were, in my opinion, they lowered them down to open it up to a whole industry. And it's interesting you use the word industry when it's an actual branch of medical science, because these are medical interventions. So the safety of these devices, they are incredibly safe devices, but it's not the device issue. It's the user of the devices. So I think what's paramount is training, but also an informed decision from the patients.
Yeah, I think that's my view, which we were briefly talking about earlier, that I don't always say that it's actually down to the device. It literally is down to the training, and I think that's where, as a company, we've kind of made sure that we don't just do literally device training. They have online training. They have to do kind of an exam before they even go into doing the practical kind of training. And I think that's key to literally succeeding with the device and making sure that kind of the patient, I suppose, is receiving the correct treatment.
I mean, if you utilize sort of what's going on now in aesthetic medicine, you look at fillers, for example. Fillers have been demonized for overfill, the overfill syndrome, pillar face, and it's not the fillers issue. It's the injectors. So what I would like to see in the future, right across the board with energy-based devices, injectables, is something I hope that you'll share this philosophy or this sort of insight, is to developing core competencies where you can tick people's competencies off, and then you can issue them with a license or a certificate to ensure patient safety or mitigation of risk when using energy-based devices. So I'd like to see core competencies come through, and a regulatory body standardise energy-based devices.
Yeah, 100%, definitely.
The safety of these devices, they are incredibly safe devices, but it's not the device issue. It's the user of the devices. So I think what's paramount is training, but also an informed decision from the patients.
Being in the industry, what's your kind of opinion on light devices? Is there anything that you think really is changing the aesthetics industry? Obviously, we've seen a huge shift from injectables, and I've kind of obviously noticed clinics are now going with like more machine-based. If there was a device that you love or you kind of have seen really take a clinic to the next level, what?
I think you have to look back into dermatology, because I think most of the energy-based devices that have been used within a clinic or hospital settings, you have to look at those and say, why are dermatologists using those? There must be some sort of scientific or evidence base behind this. So for me, it's probably fractional CO2, because back in the day, ablative CO2 was the gold standard for dermatology and plastic surgery. So now there's a sophistication with energy-based devices, so better outcomes and lower social downtime. So I think the device which would probably, if I had to choose one, it would be a fractional CO2.
Okay, amazing.
You don't agree with that?
No, I do actually. No, I do. No, actually, I do. I think it was just, we were saying, like, I think everyone's concern is the downtime, isn't it?
Yeah.
And I think, like you were saying, for the results that you're kind of wanting to get from that device, you can't not have downtime.
No, you can't eat cake and be skinny.
Yeah,
you can't have it both. You can't have it both ways. But it's about educating the patient into what social downtime is, because in my experience, 26, 27 years within this industry, often our patients think that downtime is 1 or 2 days, when it can be significantly longer, depending on the procedure that they've had done, their medical status, and lots of things in between. So I always have the rule of times 5. So if I think it's going to be 2 days, I say 10. So I think it's going to be a week, then it's going to be 5 weeks. That gives you a window of opportunity really to allow the healing process, but also allow the patient to manage their social downtime. Because, you know, you've probably seen people saying, oh, I'd love to have laser resurfacing, but my daughter gets married at the weekend, those type of things. And, you know, it's completely unrealistic. So I think we discussed before about, you know, the consultation process and how social downtime is a critical factor in patients choosing what type of energy-based device and treatments they're going to have.
Yeah, absolutely. And then talking about devices, we were talking earlier on about like RF microneedling, and obviously my opinion, which was kind of that obviously the industry at the moment, but is obviously talking about RF and the issues that has been seen. I'm obviously a huge advocate for RF and think it's probably one of the best devices that a lot of our clinics have. What's kind of your...
Well, I mean, RF has almost revolutionized aesthetic medicine, because it's that position between injectables and a little bit more of the aggressive lasers. It sits somewhere in that little space in between, and patients, they like it. And, you know, skin tightening is an incredibly popular treatment. I think if you look back to October last year, I think this is where the whole thing really starts to emanate from, about the demonization of RF microneedling from the FDA, where they seen cases of, you know, burns and fat loss and nerve damage and everything else in between. I mean, we've already intimated towards the fact that these machines are incredibly safe if you use them within the parameters which they're set.
Yeah.
It's when you take them outside of those parameters. And I always think about things like, you know, if you drive your car 150 miles an hour, you know, it can go 150 miles an hour, but if something's going to happen, it's going to be pretty catastrophic. And it's just like these machines.
Yeah.
It's how you use these safely and effectively. So stepping back from that, you look at the situation and say, okay, so what are the problems, and how can we find the solution to those problems? And again, it goes back to your point very nicely. It's all about consultation and education.
Yeah.
You know, we have to look at ourselves as a group first.
Yeah.
You know, have we been using the device the way it's supposed to be used? Are we getting a little bit too greedy? Are we trying to push the envelope of treatment a little bit too far? And in my opinion, I think it's probably yes to all of those things.
Yeah. And I think when we have seen people that have had slight issues with using devices, it's never been the device, the training. It's literally they've gone out of the guidance and they've gone and done something, a silly little mistake, or like we were talking earlier on, they think, oh, if we just literally ump the heat up a little bit, then we're just going to get a better result quicker, and that's not the case. That's when you're going to start kind of causing issues.
I think there's a phrase I use to delegates and students all across the world: you should be doing your treatment progressively, never aggressively. And I think with energy-based devices, there is a great temptation to switch it round, to do them aggressively without the progression. I think patients have to be aware as that consultation process is that this is not just a one-shot, one-fix thing. It's pretty much a long-term care and maintenance program with energy-based devices. You know, slower is better in my opinion, and you can sort of build up a wonderful rapport and relationships with the patients as you go through, and really managing expectations. I think probably managing expectations on both sides.
Yeah,
obviously,
absolutely.
you know, you've got somebody purchases a device, then they need to know the limitations, but also the patient needs to know that limitations, and in the middle is the practitioner as well.
Yeah. And if somebody obviously has a clinic and they haven't bought devices, do you think it's the way forward? Would you kind of suggest that it is kind of, I would say, like a speculate to accumulate? I think my opinion is that loads of people went into the industry doing aesthetics, whether medic or non-medic, thinking that they were going to make like obviously thousands and thousands of pounds, which is feasible. But I almost felt that everybody became the same. There was no unique selling point to their business. It was all like, we do Botox and fillers. Yeah.
I think, you know, the Botox and fillers sort of paradox, you know, you hear people saying, oh, the marketplace is now saturated, which to an extent, I wouldn't say it's saturated, but it's getting busier. And I think your point is, what happens? There's no USP, so it becomes a race to the bottom.
Yeah.
And the prices just go lower and lower, and corners need to be cut, and that's where safety becomes an issue. If you look at the way education is run now within the universities, looking at master's degrees and those type of things, then there's now energy-based devices as part of the curriculum, across the British universities that you see. So it's an incredibly important part, because there's only so much you can do with filler. There's only so much you can do with toxins. And I think we just think about lasers, don't we, as just improving skin quality, when they do so many other things as well, in terms of vascular lesions, those type of things, because those have, in my experience, really revolutionized how we look at the skin. Also, acne resurfacing, a big psychological impact on patients. With again, my own daughter suffers from it, and Abby knows her very well. And again, lasers offer that sort of solution where injectables don't. We've seen a rise in biostimulatory fillers. So your calcium hydroxyapatite, polycaprolactone, polylactic acids. And so people are aware that skin tightening and skin quality is important. And I always think it's the final sort of solution to the aging process is energy-based devices. They've been used for decades. But we're starting to now become a little bit more sophisticated, because the machines are becoming more sophisticated in the, let's say, their engineering, but their ease of use is also. I think that's an important consideration.
And I think especially with our company, when you kind of look at the interfaces of all the devices, they're used from people that have just come into the beauty or aesthetics industry all the way through to like top medics. And it's kind of everybody within that category can use the device safely. I think that's kind of really important. And like you were just saying, I think we were in a moment where everyone was kind of like overfilling faces. I certainly wasn't, and I know you weren't, but you saw a lot of practitioners doing that, and it was almost, you actually forgot about the quality of the skin, and suddenly the whole industry switched on to then skincare, looking after the skin. And I think that's where, like, I personally think devices it has a place now for that, because especially with, say, like our RF Pro is so results driven, is safe. And
you've made a good point about people becoming more aware of the skin, because again, they're seeing the volumetric changes, and then they look at the skin envelope and thinking, if I can just even my skin tone or take some of this little pigmentation away, or maybe, I've got a bit of rosacea or something like that. Also, what we need to remember is not every patient wants injectables, and not every patient is a good candidate for. So this is where energy-based devices are critical. In a treatment plan, because like that demonization of the fillers, the overfilled. I mean, for the last 2 years, hyaluronic acid fillers, I've taken quite a beating. So again, there is so what's the next big thing? Obviously biostimulatory fillers, but they come with a whole host of problems. They're non-reversible. You have a vascular issue, then you've got a big problem. So patients are looking in different ways to improve skin quality, or also tightening the skin as well. And I think that's where energy-based devices are really going to come in their own in the next couple of years, because, as I said, there's only so much that injectables can do.
Perfect. And if